Hello friend, today we are going to talk about ankylosing spondylitis. So as we all know, ankylosing spondylitis is a chronic inflammatory disease of axial spine. So ankylosing spondylitis is characterized by three common typical symptoms. These are: first one is chronic back pain, second one is progressive stiffness of spine, and third one is progressive stiffness of chest. So these are the most common clinical presentation for ankylosing spondylitis. Next, we talk about what are the common radiological signs which can be seen on X-rays. So I will classify these signs in a two categories. First one is early signs and second one is late sign. So if we talk about early signs, then there are two important signs to be remembered. First one is squaring of vertebra and second one is sine corner sign. So what is squaring of vertebra? So what happens, we do have a normal vertebra where anterior and posterior border of body of vertebra has some concavity. So in squaring of vertebra, what happens that because of some inflammation and calcification of these areas, the anterior and posterior border of vertebra become little of vertical, more flat. So that's why the normal concave or slightly concave border become flat, leads to squaring of vertebra. These are the early signs and it can be seen in lateral X-ray of spine. The next one is shiny corner sign. The three important thing is that it is also a early sign of ankylosing spondylitis. Second one is it is seen in a lateral X-ray of spine, and third is it happens because of small erosions and reactive sclerosis happening at the corner of vertebra that leads to shiny corner sign in lateral X-ray of the spine. Okay, now what about late signs of X-ray finding of ankylosing spondylitis? So if we talk about late findings, then there are two things to remember. The first one is dragger sign and second one is bamboo sign. So what is dragger? Dagger is a radiolucent line, thick line seen on a AP X-ray of lumbar spine. So what happens? These daggers radiolucent line are seen due to two reasons. First one is because of calcification of ligaments. Which ligament? Anterior longitudinal ligament, and two other ligaments are interspinous ligament and supraspinous ligament. So the calcification of these ligament plus fusion of facet joints. Fusion of facet joints plus calcification of these ligaments lead to a thick radiolucent line which is seen in an AP view of lumbar spine. This is known as dragger sign. The last one is bamboo sign. It is also a late sign for ankylosing spondylitis which is seen on AP view of spine. So what is happening in a bamboo sign? You can see that spine look like a bamboo. So why it is happening? It is happening because of fusion of vertebral body. Why vertebral body is fusing? Because of these syndesmophytes, as you can see, grow around the corner and fuse with each other. So syndesmophyte from one vertebra fuse with the syndesmophyte from the lower vertebra, and that happens along the vertebral column. That's how this normal spine start looking like a bamboo. This is known as bamboo sign of ankylosing spondylitis. So important thing to remember is that these bamboo signs are mostly late signs which leads to very high limitations of motion of spine. So spinal flexion, lateral flexion, forward flexion, extensions, all movement get grossly limited. And second thing is most commonly it happens at the thoracolumbar junction and lumbosacral junctions. So these are the important things to remember about common radiological finding in ankylosing spondylitis. Hope you liked it. See you again.